right. Welcome, everyone. It's Jeff Jenkins, Executive Director with the Texas Chiropractic Association. And I just want to welcome you guys to our webinar on healthcare planning in 2026. Um, Very excited to introduce you guys to Jeff and Melissa Street, our friends from Impact Health Sharing. We've been working with Impact for about 2 years now, and they've helped quite a few of our TCA members with their health care. And I'm going to tell you my healthcare nightmare, and maybe you have experienced it as well. But came back from a TCA trip 2 weeks ago and opened up what my insurance premiums are going to be next year, and they are going to increase 69%. They went up almost over $600 a month. So I absolutely can relate to what many of you probably are experienced. I don't know if you've all seen these kind of jumps, but now is the time to look at other alternatives, ways that you can, get good coverage, but also save money. And so I think that this may work for many of you on the call today. We hope that it's an option for you. So anyway, hope you guys learn a lot from Jeff. And, they've been very supportive of TCA. So, Jeff, I'm going to turn it over to you. And we appreciate you guys so much.
Well, Jeff, I really appreciate you. It's been our privilege over the last couple of years to work with the TCA. As some of you guys, we might have seen you at the golf outings. We've been at multiple TCA conventions back-to-back years. We've been at district events, got a chance to hang out with some people and have some fun and have some laughs. And we were at the West Texas event in Lubbock last year and just had the opportunity to connect with some incredible people. So thanks everybody for being on today. And thank you, Jeff, for hosting. I'm going to actually have my business partner and my life partner as well, my wife, Melissa, get us started here today, and I'll be back on here in a minute. But Jeff, thanks for all you do, and thanks for starting the call here today.
Yeah, just really excited to be here on behalf of the TCA, and excited that some of the students are on here as well. So what you're about to head into in the healthcare space, I'll just give you guys a quick little background because I come from corporate employee that thought if you wanted healthcare, it was in the form of traditional insurance. And so when healthcare sharing was presented to my husband and I a few years ago, it was just a whole new concept to us that we really wanted to get a better understanding of how does this apply and who does it apply to and how is this even possible. And so, my husband and I will both be able to share in depth of who and what and how does impact healthcare sharing work. But we used to have a company called Blue Cross Blue Shield, if you've ever heard of them. And we were paying almost $1,000 a month for the two of us. And this was 3 years ago. So I can't even imagine what the cost would be in 2026. And so we were paying $1,000 a month as independent contractors today. We're business owners, work from home, and we're healthy people. I mean, thank God if we ever used our insurance plan, it was for that annual wellness visit. And it was more of like a just in case, just in case if something big happens. So we were paying $1,000 a month, $12,000 a year. Our deductible as a family was $15,000 in the event something happens. And so when Impact Healthcare Sharing was introduced to us a few years ago, our cost went down to $364 a month. And we thought, wow, like this is amazing. That's almost $8,000 a year in savings for a family of two. I can't even imagine what that could be for people that have children, multiple family members on their plan. And so, I want to give you guys kind of some insight as far as like the current marketplace as what, Jeff Jenkins just shared, and also what Impact and who Impact is for. And so currently right now, Impact Health has shared about $275 million in medical expenses with over 18,000. Technically speaking, this number actually needs to change because we're over 19,000 lives that are a part of Impact Health Sharing's program now. In the last 5 years, there has been zero universal price increase. As Jeff mentioned earlier, his went up 69%. That is just wild. Impact has never had a rate increase. And when it comes to providers, the average payout is about 15 days or less turnaround. So our doctors are getting paid faster, and you're also going to learn they're getting paid more. Now, some truths of healthcare is 80% of our country right now is trying to lower their healthcare costs. And 5% of the population right now is responsible for 50% or more of the annual healthcare spending costs in our country. So what that means is indirectly, most people are overpaying for their healthcare costs. Most people are healthy to compensate for the non-healthy. And so you've seen the headlines. I'm sure you've seen it all over the news. Our government was literally shut down for 40 days because they couldn't come to an agreement about healthcare. And so you've seen it. It's not anything new you haven't heard of. But right now, people are starting to receive their renewal notices in the mail. And if you don't pay close attention to it and you're just tossing it out the door, you might get a really rude awakening when they take that first payment out of your checking account in January. See, insurance premiums are rising to 20% or more in 2026. Literally, millions of Americans will be faced with really difficult decisions. Decisions like, do I pay more for healthcare because I want to take care of my family, right? We don't want to play Russian roulette with our health, so we have to have healthcare, or just completely omit it and go without because I got to pay for groceries. I got to pay for, mortgage and whatnot. And so literally in this coming season, in this new year, people are going to have to choose one or the other. But it doesn't have to be that way when it comes to impact. And so what impact has found is that most people want affordable monthly premiums. Most people want affordable out-of-pocket expenses like copays and deductibles. Of course, all of us would want the freedom to choose the doctor that we want to go to, right? In the event your kid's sick, your parent's sick, you want to have the access to choose any doctor you want to go to. And then for all my independent, our business owners here, our chiropractors on here, if you have a practice and you have employees, you want to be able to offer healthcare for your staff, right? Because that would help with employee retention. Now, who impact is for? While healthcare sharing may not be for everybody, there's still a very large group of people that this is a great fit for. So, generally speaking, healthy to fairly healthy people that pay for some, if not all, of their own healthcare plan costs. So, any individuals or families, entrepreneurs, people that are self employed or freelance gig workers, service industry workers like hairstylists, massage therapists, waiters, senior citizens program, as long as they have Medicare Parts A and B, Impact can be a great secondary plan. And then small business owners, which most, if not all of you, are in this category with 49 employees or less. And so again, if people pay for some, if not all of their own healthcare costs, Impact could be a really great affordable plan for families and individuals. So just a couple of benefits when it comes to Impact Health. Though Impact, it feels like traditional insurance, it's not traditional insurance. And I'm just going to break that down really quick. So healthcare sharing is not a new concept. It's been around for over 40 years. So it started in the Amish community, so to speak, when one leader of the Amish community was in need during a medical expense. The community came together to say, "Hey, let's put some money in the hat and help our friend in need," right? And then Christian organizations to other nonprofit organizations followed the same fee to say, hey, this is kind of like a community approach to healthcare. So Impact Healthcare Sharing is of the similar model, though it feels like insurance because you're going to see in a moment when Jeff explains on our Impact Health Share membership card, which feels like insurance, on the back of it there's what's called a payer ID number, EDI payer ID number. And so there's a billing code that Impact can be sent electronic billing to without that out-of-pocket expense. I see Brett asked, is this the same of MediShare? It's not the same, though same concept, not the same because in healthcare sharing, usually you pay out of pocket yourself and then seek reimbursement. But with Impact, again, they have electronic billing. And also with Impact, there's no religious requirements. So just to go back with what Brett just asked, with a lot of majority of the healthcare sharing organizations, you have to be of their faith to be accepted in. Whereas with Impact, they don't care your race, your religion, your creed, your occupation. It's all walks of life. Impact is a love thy neighbor approach when it comes to healthcare. And then also Impact, it has the inclusive desire to help as many people as possible with what we call reference-based pricing. So you're going to learn more about what that means, where they advocate for their members. So it's not insurance, it's something better, and typically about 50%, sometimes even more in savings. So for me, it was more, it was almost 70% in savings when I made the switch from traditional insurance to Impact. There's no provider restriction, it's comprehensive health care. So Impact covers everything from, a cold or sinus infection to cancer to organ transplant to helicopter ambulance ride, for everything from small to big, whereas most healthcare sharing programs are catastrophic coverage only. Impact has no utilization reviews, so they do not interfere with medical and medicine practice. And there's year-round enrollment. So I know it's open enrollment season right now, so that's why a lot of people are looking for this as a solution. But if it was March and you wanted a healthcare plan to start in April, you can start it as soon as the first of the following month. Impact also includes free telehealth 24/7, a free annual wellness visit for every single family member paid up front, and also free lab work credit up to $150 per member in the household. They also include a dental and vision discount savings program. So it's not insurance, but it's almost like a pre-negotiated wholesale cost to dental and vision program. So I had something similar with Aetna insurance. It was a discount program from Aetna. So I already knew in advance what my cleaning cost was going to be or what my root canal was going to be. And it was still a lot cheaper than that, the traditional insurance route. And then for many of you, chiropractors, if not all of you, I know you're big in the health and wellness and holistic approach to healthcare. So this is something that really sets Impact apart. That can be a huge benefit, not just for you, but as you see your patients. If any of you sell supplements, maybe you do soft wave therapy, we have what's called a wellness rewards program. So anytime a Impact member spends up to $150 a month in wellness rewards, they can basically buy down their deductible by $150 a month each month. So if anyone spends money on direct primary care memberships, a DPC membership, it's almost like a concierge, a primary care physician. Naturopathic services, naturopathic medicine, holistic or functional medicine, gym memberships or fitness class subscription memberships, like a Peloton subscription. I have an at-home workout subscription, massage therapy. Maybe somebody has Massage Envy membership as well. Acupuncture, supplements. As I mentioned, Softwave. I do Softwave therapy with Dr. Tice Herger in South Lake, former TCA president. I get to save my receipts and again, submit that in as an expense each and every single month up to $150 to buy down my deductible or my primary responsibility amount with Impact. So this is fantastic. Now, some of the things that we want to try to rewire our mindset on when it comes to traditional insurance words to Impact words is, in the traditional insurance world, what they would call a deductible, which is like your out-of-pocket responsibility amount that you have to pay. Impact calls it a primary responsibility amount, or PRA. Same meaning, same experience, right? Out of pocket deductible. We call it a PRA. In the traditional world, they call it a copay, which is your out of pocket expense when you do visit an ER or an urgent care or a specialist. Impact calls it a provider fee. What you would call covered or coverage with traditional insurance, Impact calls it eligible for sharing, and insurance, what they call as co-insurance, which is basically once you've met your deductible in the traditional insurance world, you still have to pay an out-of-pocket responsibility, what they call as usually it's like a 80 to 20% rule where you're still responsible for 20% and the insurance company pays 80%. That's called co-insurance. With Impact, we call it co-share, and Impact is a 90-10 split. 90% they pay for it, 10% you pay for it. So we do have a Facebook group. You're all welcome to join us if you want to take a moment and screenshot this or scan the QR code. If you're in a place to scan a QR code, you do not have to be an Impact member to join our Facebook group, but this is more of like more information. People, real life members are sharing their medical bills. Chiropractors are in there talking about their experience with Impact and how fast they're getting paid and how much more they're getting paid. So it's just a really great opportunity to really understand more about who Impact is. But when it comes to the guidelines, which I'll post a link to the guideline here in the chat, it's very straightforward. Impact is all about ethics and honesty, so no fluff, no gray area. It's just black or white. And what they also considered as a pre-existing condition in their clause, it's what's known as sign, symptom, testing, diagnosis, treatment, or use of medication occurred within 36 months prior to enrolling for Impact Health. So if somebody is still getting treatment on something from a year ago until it's been sign symptom treatment free for 36 months from the last time they visited for that treatment, it's going to be labeled as a pre-X. And when it's labeled as a pre-X, it will be not it will be considered a non shareable medical expense until it's been signed symptom treatment free for 36 months. However, those that have high blood pressure or high cholesterol, that will not be counted as a pre-X condition for purposes of determining future eligibility for vascular or cardiac events. So as long as it's being maintained, my mom has high blood pressure, as long as it's being maintained and it's being monitored, it's not considered a pre-X. So now let's dive a little bit deeper, and I'm going to turn it over to Jeff.
No, thank you so much, Melissa. In a minute, we're going to also hear from TCA President Don White and have him share, his story and what Impact's been doing for him. I know Don's been a health sharing member for many years, even prior to getting on Impact. Many of you guys know Don very well. But when I first was introduced to Impact, like Melissa mentioned, at first, when I saw how much we were going to save, it didn't make sense to me. Like, how can we save $8,000 a year? Now, if you look at today's ACA plan, this year it's the highest health insurance premium in the history of increase in the history of healthcare. Here in Texas, on average, it's 31% is the average increase. I know Jeff mentioned his went up by 69%. I know TCA Vice President Dr. Andrew Oteo, his went up by $800 a month for his family. So these increases are really significant. For Melissa and I, if we had an ACA plan today, we'd be paying $2,500 a month for the two of us for health insurance. Instead, we pay $479 a month with Impact. Now, who'd agree $479 is better than $2,500, right? But what really made this make sense to me on how it worked is what Melissa mentioned. 5% of the population equates to 50% of the healthcare spend in our country. So that means the other 95% of the people, equates to the other 50%. Now, I fall in that 95% and probably so do most of us that are on the call. So most people are healthy or fairly healthy and having to significantly overpay for their health insurance because they have to overcompensate for people that are not healthy. The reason why healthcare sharing works so well with a model like Impact's and is saving so many people money is because we're attracting a healthy group of people. We're attracting people that are healthy or fairly healthy. Impact is not the right fit for everybody. People that have chronic conditions, Impact's not going to be the right fit for them. So because we're attracting a healthy or fairly healthy community, it drives the risk factor way down. And that's why the price is so low, because as members, we're not having to overpay to compensate for people that are not, healthy. So, what Melissa talked about pre-existing conditions, sign symptom treatment free for 36 months. So with Impact, they share in anything that's new accident, new illness, new injury. After your primary responsibility amount or combined family deductible, at that point, as Melissa mentioned, the Impact community will share it in 90% of your medical bill. You're responsible for the remaining 10%, which is called a co-share. And the most that a family could ever pay per year in co-share, think of this like a max out-of-pocket expense, is $5,000 a year per family. If you ever hit that amount, then at that point moving forward, Impact will share now 100% of your eligible medical bills. Now, again, your annual primary responsibility amount, that's the same thing as a combined family deductible. For Melissa and I, when we had Blue Cross Blue Shield, we had individual deductibles for each of us. Now, with Impact, pricing starts as low as $73 a month for individuals. I know we've got representatives from Parker and some students that are on the call here tonight. And so for those of you that are in, for those that are in their, early mid 20s, literally you can get an Impact plan as low as $73 a month. For families of 3+, it starts at $378 a month. And $96 a month for seniors. At 65, we have Impact for Seniors, which somebody can use to replace There are supplemental plans. So it's really simple for somebody to get a quote. And the TCA has their own portal with Impact. This is actually the portal right here. Our follow-up email is going to have this link in it for everybody. But so this is the TCA's Impact link. So to get a quote, it's really simple. All you have to do is put in the date of birth of the oldest person in the family. So let's say it's March 30th, 1989. And let's say it's a family of 3 plus. Get quote. So there's a quote for somebody 36 years old with a family of 3 plus. Anywhere from $404 a month to $576 a month, depending on which primary responsibility amount that you choose. So every impact quote is going to have 4 options. Now, what the options share and or cover is exactly the same. The only thing different is the primary responsibility amount that you choose. And remember, primary responsibility amount is just like a combined family deductible. So Melissa and I, we have the $2,500 PRA. So you can see for somebody that has a $2,500 PRA, a family of 3 plus at 36 years old, they'd be paying $576 a month. If they chose the highest PRA of 10,000, they'd be at $404 a month. So if you go to the website and you get yourself a quote, but then you have questions, there's a chat bot right on the website. So you can click on the chat bot and you can ask it any question you want, and it'll answer the question for you. If for any reason after asking the chatbot questions, if you still have questions and want to talk to somebody, you can actually submit yourself in as a lead for Impact. You just put in your name, email, phone number, and click on Learn More. And somebody from Impact will call you or your patient on behalf of the TCA and get any questions that they have answered. And then somebody will be directed back to this portal to sign up as an Impact member. Now, to sign up as a member, it's very simple. It takes less than 15 minutes for somebody to sign up. On the top of the page, you just click Enroll Now, and somebody becomes a member, and their membership will begin the first day of the next calendar month. So let's say somebody wanted to be an Impact member as of December 1st. They would just have to complete their enrollment by 5:59 p.m. on November 30th, and their membership begins on December 1st. So it's year-round enrollment with Impact. There is no limits of open enrollment period. Your membership will always begin the first day of the next month. And if somebody signs up as an individual or a family, there's a one-time application fee of $79. So somebody would pay that and their first month standard rate, which is like a premium, and then their membership begins. Now, let's just go back to the pricing calculator. Again, I know we have some students on the call. Let's say somebody was born in 2000. One single individual, get quote. So there's their quote, anywhere from 73 a month to 211 a month, depending on which primary responsibility amount that they choose. Now, from here, I'm going to share a couple other things with you that I think will be really helpful. But before doing so, I know we have TCA President Dr. Don White on the call. Dr. Don is also a preferred provider with Impact. He's also an Impact member himself, and he's also a referral partner. So I wanted to let you guys know as well, there is a business opportunity here as well for anybody that wants to learn more about how you can actually share Impact with your patients or people that you know and earn a residual income from being a referral partner. Those of you that want to learn more about that afterwards, I'll be able to give you my contact information where you can learn about that. But with Impact, from a provider standpoint, we're processing and paying medical bills in under 12 days time. So if you decide you want to be an Impact preferred provider, not only are we going to hope to push more members to you, but you're going to get paid a lot faster than you're getting paid with the insurance companies. They typically pay 130 to 160% of the Medicare rate. So they're paying fair market value for the providers. And obviously, I know a lot of the TCA members already switched over their healthcare coverage from Impact. And there's some amazing testimonials of people saving a lot of money. And, Don, I'd love to have you share a little bit about your experience, my friend. Well, let's see if we can get you unmuted here.
There we go. All right. Hey, everybody. It's great to see all your faces or somebody else's faces on here, but see y'all's names on here anyways. Everybody's in healthcare on here except a friend of mine, Will Mary. She actually trades on the Forex exchange for a living. She's pretty cool. We were at a real estate conference this weekend, but she and I were chatting about Impact because just like all of us, she's her own employer, and health insurance is so expensive. So my personal testimony on health shares, specifically impact, is this. My wife and I got married about 11 years ago. I'd been out of school for just a few years, out of chiropractic college for about a year, maybe two, and we had a very bare bones Blue Cross Blue Shield policy. We were paying like $13.50 a month for the two of us. We just both got life insurance policies, and we both qualified for super preferred. And those of you that don't know what that means, it means that during your physical exam, your medical testing, they determined that we were healthy enough that we didn't have to do another physical exam if we wanted to change, and by the end of that 10 years, to turn it to a whole life policy instead of just a term policy. So we were probably some of the better rates at that time, and we're like, well, we don't really have the money to do this, but we need to have some sort of coverage. And this was before we knew about health sharing at all. So after that first year, kind of like a lot of people are experiencing now, our rates just skyrocketed. They almost wanted $1,000 more a month the very next year, and we didn't make a single claim. So we're like, okay, this just isn't going to work. And so we didn't have coverage for a little while until we found out about Christian Health Shares or something like that. I can't remember which one it was. And then we went with another one after that for the next year because we weren't happy with the way they paid out. And you had to submit your claim to get any money back. And it was a whole lot of work. And then we found Impact, and Impact by far has been the greatest one because you literally just, it gets billed out like insurance from a provider standpoint. And that makes it easier for the providers. There is no network, all these great things, and you don't have to submit and wait to get your refund. So it's been great. And we have two boys, and for the four of us, it's $490 a month. We did the $7,500 PRA, and it's great. It's been wonderful. And we've only had to use it a few times, and it's just been easy as can be. So thank you to Jeff and Melissa for introducing us to this quite a few years ago now.
Well, Don, appreciate you, sharing, and a couple of other things that I want to just go through with everybody, and then we'll just answer questions here at the end. But again, so like I showed you guys a minute ago, super simple to get a quote. All you need is the date of birth of the oldest person in the family and how many people are in the family. Anybody that wants me to give you a quote at the end just to see what it looks like, you can even put in the chat the date of birth of the oldest person in your family and how many people are in the family. And I'll do a couple of quotes real quick at the end as well. But that's all the information that we need to run a quote for somebody. For anybody that is 65 or older, Impact does have a program as well. Impact for seniors. If you're 65 years old, it's $96 a month. And Impact will replace your supplemental plan as long as you have Medicare Part A and Medicare Part B. Now, here's what an Impact member card looks like. So as Don mentioned, it looks and feels like traditional insurance. You go to the provider, you give your Impact card, and on the back of the card, we have a payer ID number. So we're coded the same way as commercial insurance. So all the provider has to do is put our payer ID number in their billing system, and it allows them to bill Impact electronically. And again, Impact right now is processing and paying medical bills on average in 12 days time, which is really, really amazing. Now, Impact also has a concierge team. So when you, if you want to go and get your annual wellness visit, your physical, every member gets a free physical and also a $150 blood work credit per year per member of the family. Ladies, you could use that as on your ladies visit if you want as well. But we always encourage all Impact members to, if they can, get their free physical in their first 30 to 60 days of being a member. The reason being is Impact's concierge team, they will call up your provider and they will actually, your primary care physician, they will pay for your physical before you even walk in. So they want to do that instantly to create that connection, create that relationship with your primary care physician. Matter of fact, I go to Dr. Tice Hergert. He's my chiropractor. He also has a nurse practitioner on hand. I also go there for my physicals. So they actually paid for my physical before I walked into Dr. Tice Hergert's office, this year. So they were excited about that. And so that's great with Impact's concierge system. So Impact is architected and designed to look and feel like traditional insurance. Put in the payer ID number, bill Impact. Sometimes, just like somebody mentioned, is this like MediShare? So as Melissa mentioned earlier on, Previously, with healthcare sharing, members would always have to pay up front first, cash pay, and then wait to get reimbursed by their healthcare sharing company. And so with Impact, obviously it's different with the payer ID number, but some providers, when they see that it's a health share, they might automatically think that we have to pay as a cash pay discount. So I just like to be very transparent with people and just let them know sometimes you may get provider pushback. If that ever happens, listen, our health sharing company is a little bit different. Just put our payer ID number in your billing system. You can bill us electronically. If for any reason they won't do that, there's a provider support number. They can call, the provider can call the number. Impact will say how fast they pay, how much they pay. Most providers are extremely happy with how fast and how much Impact's paying. And usually if that happens, they'll say, wow, this is great. We definitely want to work with Impact. If for any reason at all, they won't bill Impact as a worst case scenario. Our members can pay up front as a cash pay discount and then submit it to Impact, and Impact will reimburse us, the members, as quick as they're paying their providers. Now, as I mentioned, with your primary care physician, just schedule that physical your first 30, 60 days. Impact will already get in their billing system, pay them before you go and even get your visit, and they'll have that relationship with them immediately. Now, as you guys know, there's a lot of price gouging happening in in our hospital system, and Impact will also reprice the medical bill and be our advocate and make sure we as the members are only paying fair market value. So here's just a few examples of some bills that were sent to Impact. This is my mother-in-law. I live in Highland Village in Denton County. And so my mother-in-law went to the ER here in Highland Village. They billed Impact $2,500 for her visit. Impact went over it and repriced the bill to $164.98. So she hadn't met her $2,500 PRA yet. They still repriced the bill even though she hadn't met her deductible yet. And her responsibility was $164.98. That then got subtracted from that $2,500 PRA. I know some people say, what if something significant happens with health sharing? Here's actually one of Melissa's friends who went through stage 3 breast cancer. This was actually one of her chemo bills. At this point, she had met her PRA, met that $2,500, the primary responsibility amount. Here's one of her treatments, $121,000. That bill got sent to Impact. Impact repriced it to $28,300. She was then in her 10% co-sharing because she had met her $2,500 PRA. So the Impact community paid $25,400 of her medical bill. She was only responsible for the 10%, the $2,800. But remember, the most a family can ever pay in 10% per year is $5,000. So with chemo, you have multiple bills. So here's another one. Now she had met her PRA and her 10% co-share. This treatment was $70,400. It got repriced to $15,200, and the Impact community paid 100% of that medical bill. She didn't have to pay a single dime on that bill. Now, one thing that I really love is the transparency of Impact. All of us know transparency is not normal in the health insurance space. So with Impact, with their member center, you can log in real time, actually see how much you have in financial reserves. Our technology platform is state of the art, best in class, industry leading. This is just my personal member account. So I'm one of 19,000 members. I can log in and see what's in my account real time. I can see what families I've recently helped. So right now there's $2,100 just sitting in my account. Here's some of the families that my account recently was matched with to help them pay part of their medical bills, the Pertuis household, the Yeagers, the Dermature household, the Alvarez, and so on. Now I can either remain anonymous or I can send them a get well notice or a prayer request, but I love just knowing what my money's actually going to. I don't know about anybody else, but when I paid Blue Cross Blue Shield, I never knew what my money actually went to. I love knowing that I'm helping real families, and Impact will show you how every dollar moves. They can show you what's staying in the share, what's going towards admin fees, program fees. You can see everything. You can even see the community as a whole. The goal of a healthy health sharing company is to have 3 to 4 months of financial reserves. This is a screenshot I took a month ago. At that point, they had 14 million in financial reserves. Now they have over 14.5 million. Over the last 12 months, they paid 76,000 plus medical bills. They paid $14 million in medical bills over the last 12 months. They have more than 1 year of financial reserves. That is so rare in this industry, and their model is just working so well. At the time I took the screenshot, they were processing and paying medical bills. You can see right down here, 13 days time. Now it's down to 12 days time. They show the largest shares of each month. They just show everything like full transparency. And remember the health and wellness credit? Well, this is really cool. So I can actually see real time what my PRA or my deductible is. And Melissa and I have had no medical bills this year, like most years for us. But at the time that I took this screenshot, we had already used $481 of our primary responsibility amount just by some of the adjustments we've gotten and also our $150 health and wellness credit. And so we just love the transparency of Impact. They've got amazing prescription discounts as well, best in class, cheaper than GoodRx Gold over 90% of the time. They have virtual telehealth as well, unlimited telemedicine 24/7. They have virtual mental health, 3 complimentary visits per month per member. And they're actually coming out with Life Vital Scan complimentary for all the members here in the next couple months as well, where somebody can literally scan their face through an app, and it'll give them heart rate, breathing, blood pressure, variable heart rate, cardio workload, mental health stress level. So Impact, not only are they looking to attract a healthy membership, they're looking to reward people for staying healthy and give people tools to be healthy. Now, as I mentioned before, there also is a referral partner opportunity. Here's Don in the center with his Impact banner in his office. Patients can come scan a QR code and actually get a quote. And if they become a member, for anybody that wants to learn more about the residual income opportunity and the referral partner, you earn a lifetime residual for anybody that becomes an Impact member, which is really exciting. But I want to break into Q&A. But before doing so, we have Mike Jeffrey on the call here as well. And Mike has actually spoken at many different chiropractic events outside of DFW. He's here in Trophy Club. And Mike, I'd love to have you share just a little bit about what Impact has done for yourself and some of the docs that you're working with. I think everybody really got a lot out of it.
Yeah, Jeff, thank you. Appreciate the opportunity to chime in here this evening. And for those that don't know me, my name is Mike Jeffrey. I do live in the North Texas area, Trophy Club. I'm 10 minutes from the South Lake area, which is where my chiropractor is located. My wife and I have been chiropractic patients for a very long time. We've also been Impact members for quite some time now since we got introduced to Impact here a handful of years ago. One thing I will say is that you heard Jeff and Melissa speak about the health and wellness credits for a family, $150 per month. Between leveraging those wellness credits and our regular chiropractic visits that my wife and I make on a regular basis, we were able to completely knock down a $2,500 PRA in our household in 6 months. And when I showed that to my chiropractor, who I go see every week, he was like, wow, like he understands health sharing. And I'm starting to help him. He actually has me speaking to his entire patient load the second week of December here in the local area to help people understand how they can leverage Impact, one, to save all kinds of money, like you heard Jeff and Melissa talk about compared to insurance, but also to help defray the cost of their actual chiropractic that they're paying out of pocket now today, really get no credit for that with the insurance companies. So we love it. Like we haven't gone to see a doctor, and when we do, we did our annual visits this year. And as you heard them say, Jeff and Melissa, hey, they pay ahead for your annual wellness visit. That's awesome. We loved it. It worked just the way it was designed, and so yeah, we're very, very pleased with Impact, and we are representatives of it. We're not chiropractors; we're just patients of chiropractic. We love it. We think health and wellness, and so we're sharing as much as we can about what's going on in the Impact world as Jeff and Melissa. And so, Jeff, thanks for allowing me to share a little bit here this evening. Savings wise, by the way, I'll just mention that too. The cost of our program for my wife and I was close to $1,900 a month. With Impact right now, it's $560 per month. So do the math on that, a little over $1,300 a month. So we're really pleased with that. But again, we're very, very happy with Impact and appreciate everything, Jeff, that you and Melissa are doing. So thanks very much.
No, appreciate you, Mike. And as Mike mentioned, Impact also shares into 50 chiropractic adjustments per member of the family per year as well. So between Mike and his wife's adjustments and their health and wellness credit, they literally zeroed out their deductible or PRA in 6 months. Then at that point, Impact was actually paying 90% of their chiropractic adjustment, paying 90% of the bill, paying their chiropractor, which is awesome. So again, this can be really amazing for patients to really get their costs down, not just on their healthcare plan, but also, with adjustments. So anyone that wants to learn about being a referral partner, again, that's another amazing piece of that. And then also for those of you that have employees, Impact does group plans up to 49 employees. Dr. Steve Von Osdale out of Lubbock, he was able to save, I think, $2,800 a month just for his small staff. And he took that savings and repurposed it into hiring another staff member. So for those of you that have employees that you want to be able to offer healthcare to, that's another opportunity as well. But at this point, we've done a lot of talking. I want to be able to just help get any questions that you guys have answered. No question's a bad question. We went through a lot of information quickly. But does anybody have any questions that you have? I'd love to be able to help you guys. And obviously, if there's anybody that wants me to give you a quote, be happy to run some numbers for you as well.
I have a
So Brett,
question. Sorry.
Go for it.
Coach,
Well,
go ahead, Tracy.
Hi, my question is twofold. One, I wanted to find out how long has the company been in business? Because I know you're saying a year worth of bills, that's fine, but I'm wanting to know the longevity of this company first.
Yeah, so Impact celebrates their 6-year anniversary in January. Right now, they are the fastest growing healthcare sharing company in the U.S.
Okay, the next question is, so looking at catastrophic, and I see what you're saying because it is shared, it's not regular insurance.
Yeah.
Have you heard or have they not paid anybody's bills for like a car accident or all of a sudden someone has a heart attack or anything that's just a catastrophic event?
They've never denied a claim unless it was something that didn't agree with the guidelines. So the guidelines are very, very transparent. And what's great, Tracy, is because this is just a technology system and Impact as an entity, they are a nonprofit. So it doesn't benefit them to deny a claim. There's just what is allowed in the guidelines and what's not, which is basically just, again, if something was a pre-existing condition and it's not sign symptom treatment free for 36 months, the community is not going to share in that until it is in 36 months. So all they do is they just use an algorithm. It's all technology based. And it just, money just gets transferred from one account to the other. So it's a peer-to-peer community. So Impact as the entity, they're not paying the medical bill. We are as a community. And so the bill just gets transferred from one account to the other without for me, I get notified saying a partial, like $200 or whatever is going towards paying a medical bill. But again, there is no denying claims. It's just shareable or non-shareable. Non-shareable means it doesn't meet what the guideline says. Shareable says it meets what the guideline says, and there's no gray areas. It's black and white.
So is there an intake form coming in that they see what your pre-existing conditions are, if you have any? Is it that done during the physical?
So no physical required, no blood work, no urine tests. It's all based on the honor system. There's a little questionnaire. When a medical bill gets submitted, they just look at the doctor's notes. They won't even go back to looking at a previous doctor's notes. They're just gonna do it based on the medical expertise of that provider. And so if the provider doesn't say in their records that it was anything that had anything to do with the previous condition, then it would not be a pre-existing condition. Obviously, you can't lie or anything. If you had surgery,
Oh, no, I didn't mean that. I just didn't know.
I mean, but a provider is not going to lie, but they don't dig into it. If you as the provider or your husband, I think you're a vendor, I'm sorry. So if your husband submits something, they're going to go off of what he says. They're not going to go look at previous records from our previous provider. Does that make sense?
Sure. So when you said you went to your chiropractor, so if you're going to a chiropractor to visit, is
Yeah.
that doctor sending in their specific Dale records just like anybody else would? So they have the CPT codes and they're doing everything and
Yeah.
submitting it to Impact?
Yep. Yeah. Yep. And
Okay.
for me, like I go for maintenance. So Dr. Tice like knows that because I'm going for maintenance, that he just puts on, my visit that I'm there, for maintenance, not because I got into a car accident 2 years ago.
And they'll cover the maintenance, you're saying? A
Yep.
maintenance
Yep.
visit?
Yep. Up to 50 per year per member of the family.
Okay.
Yeah.
Sorry, that's all I had. Great, thanks.
Hey, really, and Tracy, what area are you in again?
North Dallas, I'm McKinney.
That's what, yeah. So Impact is actually going to be, we're doing an event, by the way, in Richardson on December 13th. The vice president of Impact, by the way, is actually going to be it's going to be a referral partner event where they're going to be talking about, but they have a full immersive van that shows all the technology, but you, especially as a vendor, it might be something really cool. Jeff Jenkins is going to send the invite out to some people, but I just wanted to plant that seed there for yourself as well.
Okay, yeah, I'm actually I'm the vendor, but my husband's a chiropractor
Yeah, no,
too.
I know.
I'm
Yeah.
looking for the health because
Yeah,
ours is
yeah.
going up to about 30. I'm going to be paying $3,200 a month, I think.
Yeah, so
Oh,
here, let me give you a quote real quick, Tracy. What's the date of birth of the oldest person in the family?
I think I know it's 8/17/62.
8/17/62.
Yes,
And how many people are in the family?
2.
So here's your quote. So anywhere from 674 a month with the lowest combined family deductible at 2,500 to 502 a month with the 10,000. So there you can choose any of the four.
That's a family shared primary
Yes, yeah,
responsibility amount for you and your
yeah, I
husband.
see that. Okay,
And
thank
we have a little recap email that we can send to anybody that wants with your personalized quote with also the link on it. So anybody wants to put in the chat again, date of birth, the oldest person in the family, how many people are in the family, and your email address. We'll send you just a customized quote for your family too with the TCA's link directly on it. There's also a 22-minute video that'll come in the email that goes over like what we went over tonight, a little bit more, streamlined, but a lot of the same information with a lot of great bullet points. So if you want me to send that to you guys, Tracy, just put your data. I already have your stats here, but just put your email in the chat and we'll get that sent over
And
to you as well.
Jeff, while you're on the screen, Brett wanted a quote real quick. And Brett, just so you know, it's the same cost whether it's a family of 3 or more than 3. But so let's do a family of 2 for 12, 13, 1970. 12, 13, 1970 for family of 2. And I can email this over to you, Brett, if you just put
What
your
was it? Was
email
it
address in the chat.
1970? Was it?
70, yep. So family of 2. So anywhere from 513 to 341 to 513. But let's see what that cost us as a family of 3 plus in case you want to include your college kid. So 513 is the most you would pay for a $2,500 PRA for 2 people. And it'd be 628 for that same PRA. So about 13 bucks more or something like that as a family of 4 versus a family of 2. It's pretty awesome. Anybody else have any other questions? And I saw several of you guys join the Facebook group too. So we definitely have a whole section of like member guides or post guides. I think that's what it says. And we have different testimonials, kind of to Tracy, what you were talking about as far as like catastrophic events and whatnot. That my girlfriend that Jeff was just showing her medical bills when she was diagnosed with breast cancer at the beginning of this year. I mean, Impact has paid about almost $500,000 in medical bills, which is pretty wild.
Well, that's why I was asking how long they've been in business, and I
Yeah.
wanted to see if they knew what their cash flow was and how that was working. Because obviously, if you start getting people that are going to have a lot of bills, then you're kind
Yeah.
of running through your reserve, and that's the whole thing about a lot of these companies. Because I've been looking at a few of them, and there's yours and another one that I'm kind of weighing out.
Yeah. Well, I know Jeff is going to log into our member portal so you could see the full transparency of how much money is in the reserves right now with Impact. So I do love that. Like you get to see it in live time. And then how many, how much they paid in medical bills last month. So what's being taken out for admin fees, things like that. So,
And then I have a doctor that specifically said what you were saying. A lady, she said they will not use this. Like flat out, they won't use any sharing. So that's when you said you just have to do your own. You have to basically pay up front and then reimburse your, like, go ahead and submit the claims.
yeah, I had
Right.
that too, where my mom's doctor was like, we won't take healthcare sharing. But because the wellness visit is paid up front. I mean, I haven't had a doctor turn away upfront money, and that actually allowed Impact to try to create some relationship with the provider because they've already accepted that first payment. So that does sometimes happen, Tracy. But I love that Impact is very forward thinking with the hey, let's pay it upfront entirely, whatever you charge for a wellness visit, and that might open up the conversation.
Okay.
Yeah, so here, Tracy, so here's this real time. So right now, 14,575,000 in reserves. The last 12 months, they've shared in 14.3 million in medical bills over the last 12 months. And we've been having a double digit new member growth rate every single month over the previous month from the following year for 3 years in a row. The last this month will be our biggest month ever with new member enrollments with everything that's going on with with health insurance premium increases. But remember, we're getting that healthy, fairly healthy community. So they've got, this really, really dialed in. Again, the goal of a health sharing company is 3 to 4 months of reserves. And you can see 14.3 million over the last 12 months, 14 point almost 6 million in reserves. So they're over a year, of reserves. I don't think there's any other health sharing company that even shows you like what they have in reserves and shows you the books. Certainly no health insurance companies are. So this is something that we're really, really confident in. And they're giving away extra because they're a nonprofit. They don't need to have more than 12 months in reserves. So that's why they're giving away now all these additional member benefits like the free dental vision discount card and the mental health free 3 visits per month, and all these things that they're now giving away just because as a nonprofit, they don't need to have more than 12 months of reserves.
Right. Unless you get a lot of unhealthy people because the price is cheaper to keep going in and then they have a lot of bills. That's what the
Yeah.
other one I was looking at, and they couldn't answer some of the questions. So it was like, I'm kind of just double checking on all of the
Yeah,
people's.
no question's a bad question. And, again, I appreciate your questions. And Impact is 100% transparent and so are we. So
No,
for
that's great
people,
because actually you're right. Most of the people like me, I'm just looking for catastrophic and to
yeah.
pay. I like HSA plans, but to pay $3,200 a month right now with a $7,500 deductible each person, I'm like, well, and then it could be actually up to $60,000 for the year
Yeah,
if I wanted to go that route. And
which
I'm
is
like,
crazy.
okay, and I'm not using you. I'm not using it.
Yeah.
Like literally, like that's, not
That's
too
like a
much. That's
mortgage.
that's close to what my mortgage payment is, like somebody's healthcare payment. So
Yeah.
I just have a
Yeah.
quick question. What does the like the dental and vision discounts look like?
let me pull it up for you, Zeb. And so with the dental and vision, we use the Carrington network. So the dental and vision, it's not like a share like the healthcare part. It's like pre-negotiated contracted rates through Carrington. So with this, there are specific doctors that you go to. So I'll put in your zip code real quick and just kind of show you what it looks like. But so for like a routine checkup, instead of $93 with the plan, it's an average of 63% savings. So it'd be $34 a month. And obviously there's no monthly
Month a visit.
yeah, a visit. I'm sorry. So I was about to say there's no monthly fee. And so for me, I've actually been on a dental vision discount program for a while. My dentist was like, hey, you just come in for like a cleaning once a year. Like, why are you paying all this money? He said, you can pay $300 a year for Aetna's program and then only use it when you need to. And so it's actually even cheaper than that. And there's no annual cost for it for Impact members. So adult cleanings, $65. Oral exam 15. I mean, you can kind of see it there, if you want a crown put in 789. But what's your zip code there, Zeb? And I'll
Um,
just
you can put in 75062 for Irving, but I'm actually from Wyoming, so this is good information. I think my family's looking into changing plans, so
yeah.
um
It impacts nationwide. I mean, this call obviously we've been focused on Texas because of the TCA, but
right.
impact is nationwide. And so here's in the Irving, in the Irving area, these are just all the different
There's
dentists.
a lot. They have thousands in their network.
Yeah, so that's just in that zip
Irving,
code.
yeah.
There's a bunch of them that showed up. So
Well, that's really good to know. Yeah, I think my brother and sister-in-law are with Christian Health Share, and I think they might be wanting to change, so I will let them know.
yeah, and speaking of that, Zeb, let me just share this with everybody as well. This is my personal cell phone number right here as well. Anybody that wants to learn about being a referral partner, where like Zeb, you're already like naturally referring. So there is a business opportunity, there is a residual income opportunity for anybody that wants to learn about that. If you text the word partner and your name to my cell phone number, I'll get you the information on the business opportunity side for anybody that wants to learn about that. Again, we'll get the email out to everybody just on the healthcare side where TCA's link will be in there where somebody can enroll as a impact member. But it also is good for the TCA for anybody that wants to be a referral partner. So that's not taking anything away from the TCA. That helps them as well. And they want members that want to create additional residual income to be able to do so. Obviously, if you don't want to do that, we just want to be able to help you on your health care. And what's great is that's now revenue that goes towards the TCA as a referral partner with us. We pay the TCA a residual income, which can help them create non-dues revenue for them to be able to continue to fight the fight and do what they're doing for all of you guys to just be that advocate for obviously for the for your profession. So but again, anybody that wants to learn about the business opportunity, text me your name and the word partner to that number, and I'll get in touch with you and get you that information.
Yeah, and Dennis and Brett, I got your emails and the birth dates and all that. So I'll send you an email shortly with your impact quote plus like pretty much all the bullet points and some additional information of impact. Zeb, if you want me to send you one just so you can share that with your siblings, like your example of your quote, I can definitely do that too. Just feel free to put your email address in the chat.
And then Tracy, let's see, do I have your email? No, I don't. Did Tracy put her email in the chat?
No, let's see. Well, that's okay. If you're going to send it to me, I wrote it down.
Yeah, well, I'm just going to send you something, Tracy, that has more like detailed information in
Oh,
there.
okay. Yeah, that's
It's
fine.
like a
Let me put it in
whole
there.
quote that we would normally send to somebody.
Yeah. Jeff,
Um,
can you pull that screen
yeah,
back up?
77441. Yeah,
Mhm.
just saw that. Jay
Full
on
shear.
show, ACTA.
I've never heard of this part of Texas. Full shear. Where is that? So lots. Yep.
That's what it looks like there. Anybody else? Any questions? Well, you guys have been a great audience. I hope that we're able to provide value for you. On anything else you want to say in closing, buddy?
No, thank you for all for being here. Reach out to me, reach out to Jeff, reach out to Melissa, or anybody at the TCA office, and we're happy to help y'all out.
Deb, I got your email. Thank you. I'll get that all sent out to everybody.
And Melissa, did you get everything from the chat?
Yes, other than Tracy's email address. Did you need that? You were sending, are you sending her a quote or are you sending her something?
If
I
you
already
can,
put it in there. It's in there. I
and
put it in
Tracy,
there somewhere.
I got
give me your date of birth again of the oldest person.
Sorry, 8/17/62.
8/17/62,
two
and there's
people.
two of you guys, right?
Yes.
All
Perfect.
right. Melissa, you
Got it.
got that email address?
Yep.
Thomas,
Thomas, I can send you, yes, we can get you a recording if you could write your email address, and Jeff Jenkins can forward you a recording of this specific webinar. I can also send you, in the meantime, a 22-minute presentation of impact. It's like a concise, short version. But we can
and
get started.
Thomas, actually, are you yeah, I saw your email there. If you want to put in your date of birth and how many people are in your family, we can just send you an email that'll give you a quote and also will have that 22-minute video on it and some good bullet points on there as well. So if you can, just put in the date of birth and how many people are in the family, and we'll shoot that whole thing over to you.